Hello, I'm Jennifer Kim from the Cancer Caring Center, and welcome to our what would normally be our Wednesday general cancer group, but it's on Monday today. So we're very excited to be able to have our guest speaker, Dr. Van Londen. But I know we have a lot of folks who have not, may not have ever come to a Cancer Caring Center call. And I just wanted to introduce myself. Wendy had a conflict and is not going to be able to join us this afternoon. So I just wanted to let you know that. Dr. Van Londen is here, and Rebecca Whitlinger, our executive director, is on the call as well. If you haven't been to a Cancer Caring Center Zoom call before, we are a 33-year-old nonprofit in the city of Pittsburgh, and we offer social and emotional support for cancer patients and their loved ones. So we have right now about 37 different Zoom calls a month with a variety of topics, whether it's general cancer, general women's cancer, and we have cancer specific. In fact, I think let me pull up. I'll show you real quick. So I don't know if you'll be able to see this, but you can kind of see that we have a new group coming on post-treatment, moving on support, brain tumor, African American, breast cancer. We have I run the young women's breast cancer support group, head and neck. We also have a grief series, caregiver series. And we have tonight at 7 o'clock, if you still are with me, we have a cognitive toolbox, which is once a month, is a chemo brain class. We also have wellness groups such as nutrition classes, gentle movement and breathing, art therapy. And what I like to call is our secret weapon is Wendy Myers, who does our one-on-one private counseling, survivors, caregivers, individuals. And you may not know this, but we also have an agreement with Reed Smith, and we do wills, power of attorney, and advance directives for all cancer families. So if you are in need of those, that's a free service that Reed Smith has been doing for our families for over a year now, and it's been wonderful. So we really appreciate their support. And I'd like to ask everybody to mute themselves if they could, because we have a lot of folks on the call today.
How do you do that?
Oh, okay. And Dr. Van Londen she's putting some stuff in the chat about the vaccine. So if you want to look at that as well, you can. And then Dr. Van Londen, what we can do is, and if you haven't met Dr. Van Londen, you're in for a treat. She's an amazing physician. She's a medical oncologist and geriatrician at UPMC Hillman Cancer Center. She's the director of the Women's Cancer Live Well Survivorship Program at UPMC Magee Women's Hospital, and the director of the Cancer Live Well Survivorship Program at UPMC Hillman Cancer Center. Her research interests focus on a wide variety of topics relevant to survivors via multiple collaborations, but her particular interest relates to the assessment and management of adverse effects of adjuvant endocrine therapy in older cancer survivors. Dr. Van Londen is board certified in internal medicine, medical oncology, and geriatric medicine. She has received a medical degree at the University of Utrecht. Is that right? And then
a huge introduction.
What's that?
Yeah, you were close, but it makes me a little shy.
No, I meant the name of your university.
Yeah, you were close. Yes.
Yeah, okay.
We're good enough. Thank you.
All right. Well, and she had a fellowship at hematology at the University of Pittsburgh School of Medicine. But and some of you may know her because she has her own blog and social media sites, Cancer Survivor MD, which is on social media. If you don't follow her, I highly recommend that you do. And so obviously she is a cancer survivor, and then also more recently had COVID. So we think is the perfect speaker for this evening tonight. She's a great friend to myself and a wonderful supporter of the Cancer Caring Center. So we are incredibly grateful to have her tonight. We have a lot of people on the call, and I'm sure you have a lot of questions. So what we'll have Dr. Van Lunden speak first, and then you can ask questions. And, do you think we should probably have people? I don't know if everybody knows how to raise their hand in the chat. Either that, or you could just physically raise your hand if you if you don't know how to raise it in the chat. But we have a lot of folks, so I just want to try to get to everybody, and then also to try to do it in an organized way. So I am going to turn the spotlight over to you, Dr. Van Lunden, and you can go ahead.
Thank you, Jen. You're staying, right?
Yes, I am staying.
Okay, that's good. Because I'm not doing slides today. I didn't know how to prepare slides because all of you are probably in different levels of understanding and different levels of learning about this. And it's very rapidly changing. And so what I decided to do for tonight, we have about 45 minutes left, if that's okay with all of you, is maybe I'll tell you a little bit where you can find information which is regularly updated, is validated, and then maybe open it up to questions, because I have no idea where any of you are gonna come from in terms of what you want to know, if that's okay with all of you. And I'm hoping that through some of your questions, maybe other people's questions and information will be expanded too, if that's okay with you. So what I put in the chat function, I don't know how many of you, hopefully all of you, know how to find a chat function in your app or on the computer. Do all of you know how to find a little chat window?
Nope.
Donna is saying no. Okay. Are you on a computer or are you on a device, Donna?
On the phone. On the phone.
Okay, so if you touch your screen, little things will pop up in the bottom usually. Your
Yes.
light bulb went on. So one of them is that you can mute yourself or unmute, and another one is the camera on and off, and the other one is you probably see little red cloud with a number in it because there's already 6 text messages there. And so those things, those chat messages will disappear when we close the Zoom. And so the way to conserve it is either make a picture of the screen or touch them and open it in a new window and then come back here, so they will be there for later. Plus, I have a feeling Jen is probably going to compile these sites, I think, and maybe we'll send it to you later.
I will try.
Okay. So if don't be distracted by trying to keep track of these sites. There's only 3, by the way, but I prefer you listen. So 2 of them are from the New York Times, and the reason I did that, because most of you probably don't have a membership, but you don't need to. The New York Times provides free access to all the information related to COVID, all their articles, all their trackers, their calculators. And so some resources I put out here, 2 websites that I really like. One is on the latest and greatest in terms of drug treatments. You can track the vaccination progress, you can track the approval process, and another site that tracks the COVID progress on its own. That is for the New York Times links. What I also put in there is the FDA links in terms of its progress.
Leave the
Go ahead.
thing and start it again. Oh, here's
Doing it
I don't know who's talking right now. Hold on.
how did you do it?
on top. They have a microphone to the left.
If everybody could please mute themselves while we're talking.
I think that. Wait, I was muted too. Okay, so we having fun yet? So another link put in there is for the FDA. As you know, the FDA has approved 2. They're thinking about the 3rd. To tell you the truth, it's very confusing, not just for you, but also for me. And so hopefully that's somewhat validating to all of you to know that's even mind-boggling for me. As far as I can understand, the FDA is deciding on a third vaccination to be approved, which is my understanding, it's one from Janssen. However, when I went to the New York Times website to look up more information about that particular immunization, it doesn't seem to be listed there. And so what I'm trying to say is it's mind-boggling. It's changing very, very quickly. And so don't be too overwhelmed. I think message number one is we're all confused. You're not the only one. I think message number two is the light is there at the end of the tunnel, although maybe not as close as we all like it to be. The predictions are that if we continue at the same speed, over 90% of our United States population will be immunized by the end of this calendar year, which takes a really long time. But my hope is that once more immunizations are being approved FDA-wise, produced at max scale and then distributed, hopefully that timeline will move up to the fall. But I don't think it's going to necessarily move up to the summer though. But I'm hoping by the fall that timeline will have moved up just a teeny tiny little bit. Not to make anybody's balloon pop, but even if you got a vaccination or two, depending on whether your particular one that you cannot often choose, by the way. Message number three is, even if you get your immunization, if you're lucky enough to find somewhere, somehow a spot, and we'll talk about that too, you should still continue to be careful. This is just like the flu shot. It doesn't prevent you from getting the flu. And the COVID shot doesn't prevent you from getting COVID. But the hope is that your risk of, if I can say it very graphically, the risk of you dying from COVID or needing to go to the hospital from COVID will be drastically reduced, meaning it should just become somewhat of a mild outpatient disease. But it doesn't prevent you from getting COVID, meaning you still should continue to be careful and continue to wear your mask. You can still become colonized. So that was message number three. Message number four is that for most of you, it is highly confusing whether it's your turn. How do you determine if it's your turn? And if it's your turn, where in Flip's name can you find somebody who's going to give it to you? I can tell you that all of my patients have massively emailed and called me and asked me for help. And so I know that many of you are probably struggling with this. I don't know how active of an issue that is for this group. And there's 34 people. Is there a way maybe you can wave so I can count how many of you are signed up or scheduled to get your shots? Okay, that's about half on this screen, I think. And half, so it's about half. Okay, let me ask you a different question. For those people that are not signed up and did not yet receive any shot yet, how many of those are working on it but have trouble getting it? Does that make sense? So Chuck is shaking his hand. There's Ann down there. You think it's the minority, right? Just two people. Is that correct? Okay, so you're not the only one. First of all, it's very confusing to know whether it's your turn, and second of all, it's confusing to know where to sign up. Pennsylvania, I don't know why it took them so long. I don't get me going, but Pennsylvania is working on a Pennsylvania-wide registry so that all of us can sign up there. On top of that, what I really like, but that's maybe because I'm biased, is if you go to this particular link, and I'm going to put this in here for all of you to see, and maybe Jennifer, Jen, will you be willing to share this again? This is a link. I work for UPMC, so this is a UPMC link. But that link does two things. First of all, it asks you to go to a validated, reliable calculator that's being used to triage to see if it's your turn. If it's your turn, they continue filling out that form. UPMC is very paranoid about HIPAA security, so I can guarantee that this system, where it asks for your date of birth, will be treated very confidentially. And then you're being put on a wait list where you will be contacted without you needing to continue to call to get the shot when the shot is there. I think that gives many people peace of mind. On top of that, outside of UPMC and outside of Allegheny has a similar link that I don't really know. Jen, do you happen to have Allegheny Health Network's link?
I don't, but I can probably locate it.
Would you mind Googling it while we talk? If not, I'll try to find it later.
I believe that it's a part of my chart because that's the email I got last night. You have to be signed up in their my chart.
So you just can't do it the way UPMC does it.
Does not appear that way.
Okay, well, thank you. That answers that. That's why there's no link circulating. I'm on a Pittsburgh Physician Secret Facebook group, and I can tell you that there's massive links circulating that we're all trying to give to our patients, which is mind-boggling. But the two that seem to pop out are Rite Aid and the Giant Eagle. Those are two systems that seem to work. So those are the other two tips I would like to give you, Rite Aid and Giant Eagle. And then there is these gazillion moms and pops pharmacies that are all over the place that seem to have a word of mouth spread of, information in terms of whether or not they have the vaccination. I probably shouldn't say this, but it always makes me a little bit, I don't know how much support they have available at these smaller shops to help you if you should develop an acute reaction. And maybe that is the next take-home item we should move to. It's tolerability. And then I'll talk about who is eligible, as Kemi's asking here. Am I safe to get it? And then I'll open it up to the group. So none of these immunizations we have long-term data on. None of them do. They're all newly invented. However, the currently distributed messenger RNA vaccinations through Pfizer and Moderna, they use a technology that we have been using in oncology for a really long time. So it's not that novel. It's just novel that we're using it now, not for cancer treatments, but we're using it to protect you from infection. So yes, we still lack, to some degree, long-term safety data, and that's why not everybody is comfortable necessarily getting the immunization. As far as these two immunizations that are FDA approved, Pfizer and Moderna, they are dead. The virus itself is dead. It's actually just an teeny tiny bit of RNA structure that's replicated from the virus, but the virus is dead, meaning you cannot get the virus from these two currently FDA approved immunizations, and you can't choose. You just get the one wherever you sign up. You can't choose for one versus the other. Either one is okay. They're very comparable in their effectiveness at this point. The short-term effects, the one thing to note, if you have a history of what we call anaphylaxis, which is a very severe allergic reaction to something. If you've ever had anaphylaxis before, which manifests itself with shortness of breath, swelling of your throat, difficulty breathing, for which you need to go to the emergency room and be closely monitored for 1 or several days. If you've ever been told that you have a history of anaphylaxis, the recommendation is that you talk with your doctor, whichever doctor you trust, probably your primary care doctor, to explore if the COVID vaccination is safe for you. Short of having a history of anaphylaxis, the severe allergic reaction to, you can have that to anything, but most people have it just to one particular something that's in their environment. But if you don't have a history of anaphylaxis, most of you can get this immunization without a problem. Let's stick with the side effects for a moment. Most individuals do really well. With the first shot, the second shot, most people do well. There are some people, and you've probably heard and read about that, in whom it becomes a little bit tougher, and they develop so-called flu-like symptoms that are very usually short-lived and stop quite abruptly, maybe 24, 48, 72 hours after you got the shot. And that is because your body is doing what it needs to do. Its white blood cells are being stimulated to create an immune response to this shot that usually you get in your arm. And that's what it's supposed to do. There is no data to say that, as far as I can tell right now, but probably it will come, that those who have a bigger response to their immunizations, are they better protected? Is it a good thing that you have a better response? We don't know. There were some physicians asking again in this Facebook group, I didn't have any response. Are you sure they gave me the right shot? There's some people out there who got no response whatsoever. So if that happens to be you, good for you. I'm not sure we can say that that is a bad thing or a good thing, but I would count on just laying low for 1, 2, 3 days after each of the shots, just in case you're reacting, that you have all your shoppings at home. You don't have to go out of your way to do too much. Just have your TV shows ready to go and something for you to entertain yourself with if you do react. That is in terms of the safety, in terms of who is eligible, and in particular, are cancer patients okay to get this? As I mentioned, the current 2 vaccinations, Moderna's and Pfizer's, and the next one that's in the lineup to be FDA approved also, are dead. Meaning, if you're immunocompromised for whatever reason, this, whatever they inject here, is not going to freely spread through your body, because what they're injecting is dead. The only caveat is if you're on active therapy, or you've had active therapy such as chemotherapy in the last 3 months, your immune system may not be as able to mount a response to the immunization as we would like to. However, at the current time, most of us are still recommending, if you're being offered to get the vaccine, just go for it, because who knows what is going to happen next. And so most of us, including Dr. Marks, he went on the social media. Most of us, we do not necessarily say don't take it, but I would suggest, and this is again a disclaimer, that you discuss that with your cancer doctor. There's some regimens that make it totally a moot point for you to get your immunization. It's like your immunity is not going to respond at all. And so for those that are on active therapy, I would suggest you discuss with your cancer doctor about the timing of getting the shots, knowing it should not hurt you. The problem is, how can we time it so you get the best benefit? If it's really difficult to time, then I would say maybe just go for it. But I would discuss with your doctor if I make sense. Then there is a question out here. I had a severe reaction to paclitaxel. Okay, so somebody here, I won't disclose the name because it was just a direct message to me, had a significant reaction to a chemo agent, similar to anaphylaxis, but it wasn't anaphylaxis. And that's a very good question. It should still be okay. I don't know this person, if this person knows I'm addressing her question. If you had a significant reaction to a medication called paclitaxel, it probably was from the paclitaxel itself, which is known to have triggers in there that can make people really sick, meaning that it's not a trigger in your environment, it's really a trigger very specific to this cancer treatment, not really allergy based. And so yes, you should be fine, but I would talk with your cancer doctor. This person is texting me, so I guess she hears me. I would double check with your cancer doctor just to make sure that you are okay to get it. But my gut feeling is yes. You did not have a reaction to something in your environment. You had a very stereotypical reaction to the chemotherapy. That's different from anaphylaxis, if I make sense. Then I know there's some people sticking up their hand in the audience, and I also see that Harriet is sending a message for, this is, I think, Allegheny Health Network. Apparently you can't sign up by through the internet, but you can call them apparently, 412-362-8667. That's Allegheny Health Network's phone number, I think. So I'm guessing that there's a way there you can sign up for COVID. I don't know for sure, but that's what somebody's texting here. And then somebody, before I go to the audience, let me answer one more question here. But there's two more. Jen, do you think I should go to the audience for a second before I go back to these chat questions? Because it's coming from everywhere now.
Yeah, I know.
Like a whack-a-mole.
It is hard. Some of them are similar, but
I know. Is this helpful for you? I feel like I'm just rambling. Is this,
I think it's
helpful?
incredibly helpful. But there, I think there are so many nuances for people.
Yes.
One of the common, and I think you may have addressed this, but one of the common things is, if you're on hormone therapy, if you're on
Oh, I missed that one. Yeah, hormone therapy is fine. Hormone therapy doesn't interfere with your immune system. If somebody asks a question, I'm on immunotherapy, that would be a question I would ask your cancer doctor, because there's a lot of nuances there that are specific to the patient. So I would say if you're on immunotherapy, chemotherapy, and you have an opportunity to get the shot, I would reach out to your cancer doctor and ask them, hey, what do you advise me to do? Shall I wait 2 more weeks until I'm in that in between 2 cycles, or what do you think I should do, and most importantly can do? Because when they give you the opportunity to schedule, you may only have a very small window to put it in, and so it's very, very frustrating to do this. Yeah, my doc said Mary is typing here to do it when I'm in my off week. Correct. Yeah, correct. That's probably the best thing to do. But some chemos don't end; they keep going, and so I'm giving you a cookie cutter disclaimer response.
there's a question in here. Since there were no cancer patients in the trials,
Yes,
is data
correct. We don't know.
Okay.
We don't know. I wish.
Vaccine have adverse effect on people with autoimmune or inflammatory problems.
Yeah, okay, so that's a very good one. As far as we can tell, no. There is no bigger or smaller problems in those who have, in general, a history of something wrong with their immune system, whether it's a primary immunity problem or an autoimmunity problem. As far as we can tell, both groups of individuals can get the shot and should do okay. It's more the other medications you're on to control that underlying condition that you may need to talk with your rheumatologist or your immunologist about. Same thing. Hey, is there a better timing for me to get the shot? Do you recommend for or against it? Just a little, hopefully you can just send them an email or a phone call with the nurse, just to make sure you clear yourself and you try to determine when is the optimal timing for me to get it. Knowing that when you get to the sign up sheet for scheduling your shot, that there may only be a very small window of opportunity. And then you have to have the dilemma, am I going to wait until hopefully they will reach out to me the next time? It is a zoo. This is not necessarily making you feel any better, I'm guessing, but there's some people with their hands up. Shall I ask them some questions, Jen?
Oh, okay. Yeah, there's just, well, I think you might have answered this. Does immunotherapy Keytruda respond well to the COVID vaccine? I mean, that we kind of said, you kind of said, talk to your doctor about that, right?
Yeah. Yeah, I would do that. Edie, do I mispronounce your name? Edie, would you like to ask me the question this way or type it in the chat? And then there's Olga, and there's a person with, I think, last name DiCarlo. If you know how to unmute yourself, you can ask the question or just text it. Olga has unmuted herself. Go ahead.
Yeah, you have answered my questions. Thank you. It's very informative.
I'm trying. I'm trying. It's the information is just exploding and it's really hard to make any sense of it. By the way, Noelle is very good. Noelle has put a Facebook group on here. I'm not sure how many of you are on Facebook, but there is a Facebook group and other people are setting up similar things that are not through Facebook, where they're trying to help you through a volunteer system to sign you up for a shot, which in many people's cases takes hours to get somebody sign up for. So Noelle put a Facebook link in there. I know there's other websites too, but I can't vouch for them though. So don't come and throw tomato at me if I just be very careful with putting your date of birth, because there's a lot of people out there who abuse this. They're fishing for your information to steal your identity. So triple check that what you're filling your information into is really the website you wanted to fill into, and that there's a little lock on the top that says it's private, because there's some people who had their identity stolen because people are just people. Okay.
DiCarlo,
Yeah,
would you want to?
Hi,
Oh, hi.
sure. Hi,
Yes,
I think I may have stepped away and I'm not sure if you answered my question. I did put it in the chat, but I wanted to know, I am actually taking a Remedex, the hormone therapy. Did you mention that that's safe to get with the vaccine?
Yes, that's fine. It does not interfere one way or the other. Yes.
Okay, great. Thank you.
You're welcome.
And then Edith, I don't know if you're able to ask your question right now.
Now, I just wanted to thank you for your expertise and wish you well and wish all of us a safe journey.
Thank you.
Well, that's the key, right? All of us, we need to stick together. I think Sue has a question. Is Sue waving at me? And Kathy there up to, yeah, go ahead. Sue, you want to go first?
Yeah, sure. My question is, since the Johnson & Johnson vaccine does not use that mRNA technology, do you think that there might be an advantage in holding out and waiting for that one?
The short answer is I don't know. It has a lot of pros, but also some cons. The pro is that I think it's only one shot, doesn't need to be frozen. But the con is it's not here yet. And second of all, the effectiveness is a little less in terms of preventing you from getting really sick from it, needing to go to hospital, and maybe even dying from it. It protects you less. Still reasonable at the numbers, I think, but it's not as high as the other two are over 90s. And so I would say if you can get a shot now or yesterday, I would say go for it. Because when you weigh the pros and the cons, I don't mean to scare anybody here, but I think the newspapers and the TV has done that for me already. It's like this virus can hit people in unpredictable ways. People who we thought were going to do very bad with it, they make it. It's just unpredictable. We still don't know who will not do well with COVID. And so I would say if you can protect yourself, everybody has to make their own decision. I'm not judging you. You have to talk with your doctors and your family members, but I would say if you can get it yesterday, go for it. Most individuals, the pros are outweighing the cons. I don't know if that helps answer your question.
Well, I'm confused because my oncologist wants me to get it and my PCP does not want me to get it.
Okay, that's helpful, isn't it?
No.
Yeah, that was meant in an ironic way. I don't know how specific, there's like 40 people looking at you now. I don't know if you want to get really into the details, but I would say if you have two people who don't agree, you either get a third one or you have these two people talk together and figure it out for you. Because right now you're stuck in the middle and that's not a nice place to be in. Do I make sense?
No.
I know, sweetie. I don't know if you can get these two people to come on the phone.
Well, my question, Sue, would be why does your PCP not want you to get it?
I know, but then you wait, you have 40 people looking at you. So I don't
Okay,
want
all
you to
right.
disclose
I'm
the
sorry.
private- Yeah. Yeah, I don't want you to.
Shirley, you were waving before. I don't know. Did you have a question? You're on mute.
Wait, and Kathy also has a question.
Oh, I'm sorry. I
Can I ask quick?
There I am. Well, once this third one comes in and you haven't got the other ones that are available now, and you get scheduled to get one, would you have a choice of, you won't have a choice, then you might end up getting that third one that has more cons than pros. And then my other one I have here is the Hillman Cancer Center going to be offering vaccines to us cancer patients?
We will, but the question is when. Right now, there's multiple pipeline problems. One is the FDA only has approved 2. So we're trying to get the FDA to approve more so that we can have more supply. Second problem that we're having is we just don't have enough vaccines where we need them to be. It's not so much a problem of not having enough people to administer it, but we don't have enough vaccines.
Why is everyone else getting it, and not UPMC? You hear this hospital's getting it, AGH is getting it, but UPMC doesn't have anything.
The reason for that is I was told, but again, I'm just a messenger here because I only get told what I get told. Each institution has to follow the pathway, and institutions need to immunize their own providers first before they go to patients. And the problem with UPMC is they have a boatload of providers. And so before they get through all of those, UPMC is all throughout.
They're bigger.
Yes. And so before they get through all those people, and even there, they don't have enough vaccine. So it's a whole pipeline issue. Like we don't have enough approved. If we get more approved and we can get more factories to jump them out, then we can get them to the places where they go. And then we need manpower to vaccinate them into people. And so we need to get the pipeline. I'm guessing it will be earlier than December when we get the majority of the population vaccinated, but it requires a lot of churning wheels to be aligned. Do I make sense, Shirley?
Yeah, and I'm hoping that our group, we're in 1A, of course, with the cancer and then our age and stuff, that
Correct. I think you all
we
are.
should be looking at 2 months down the road at least. I mean, I'm not stressing myself to get anything. I'm just staying at home, and being very careful, because I'd rather wait than, rush into it.
You're doing good, Shirley. There's a lot of people get very worked up over this.
Yeah, they're getting all stressed, and
I can
I don't think
understand.
that's a good thing when you have cancer.
No, but they have a point though. The system shouldn't be this
Oh,
frustrating.
absolutely. And we're in it. There's nothing we can do about it.
No.
It's the government and, so.
Kathy, I think you have a, oh, who's,
I've heard of some people having swelling of the lymph nodes after getting a mammogram. The mammogram is maybe a week or two out from the shot. And I'm scheduled for a mammogram. I didn't know your thoughts on that. My PCP said, go ahead. If it's just discomfort, that's one thing, but if it's inflammation, I don't want to.
let me say it this way, as far as I can tell, there's no official national guidelines related to that yet, but correct. Some people do respond with quite a lymph node burden in that area. So even in your chest, if you need to do a CT scan of your chest for whatever reason, it might show up with some lymph nodes that are only there because of the shot, that there's no way for us to know if they were there before or not. And so I'm not here to say, you know what, delay all your testing, or the other way around, delay your COVID shot until after your testing is done. But there is some possibility that it might trigger false positive findings in your imaging. Nationwide, there's not yet any recommendations as to whether we should proactively separate the two out. I don't know how to answer that, other than I think everybody right now needs to make their own decision, what you think you can do and you feel comfortable with.
Thank you. That helps me. Thank you.
Okay, good, Kathy.
Wonderful program.
Thank you. I am a
Yeah,
little
I
concerned.
have,
Where do I go next?
Mary Mullen had asked in the
Okay.
chat to ask a question.
Mary,
So
go
this
ahead.
this is more post-COVID shots, like
Oh, yeah.
in the future.
Okay.
So I don't know if you want to wait till the end for me to ask this, or just do it now. Like, so my question is, like, what, I haven't paid much to what's after we get the COVID vaccine. Is this going to be a yearly thing? Is it just going to be a booster? Do we even know that yet?
The short answer, we don't know. But the long-winded answer is, in all likelihood, yes. You will need, just like the annual flu shot, you will need probably, don't throw a tomato if this is wrong too, but you probably will need an annual COVID shot. And people are already looking into, can you get that in the same shot? So you only have to go out once. Whether that's for this fall, probably not. Probably for next fall that you're going to have the 2-in-1. And the reason for that is not so much the fact that these antibodies are disappearing, which everybody's reading about, which is actually quite a natural thing to happen. Your body doesn't continue to make antibodies for everything all the time. It's inefficient. Your body stops making antibodies when the trigger is gone. But they're laying in standby, and they can pop up the minute that new antigen is back in their system, if that makes sense. And so the fact that these antibodies are not measurable after a while, I'm not sure that is that surprising. It's more that you may need a booster every year, in terms of the fact that these viruses are mutating. The flu does that, and COVID obviously does that too. That's just inherent to the virus. It may just be that you need a super deluxe Cadillac version of a flu shot every year.
Thank you.
You're welcome. There's another Mary up there too. Mary's iPads. Wait,
okay, I'm unmuted. Thank you.
It's okay.
This has been wonderful, Dr. Van London. Long time no see. But I guess I'm confused. I haven't had cancer in 12 years, but I'm high risk with obesity, diabetes, but I'm very leery of getting the vaccine because there aren't a lot of I mean, like you said, long-term studies. I've had one physician, one of my doctors told me that these are well proven. They've just been tweaked for COVID. But then I heard you say that like the technology's been used in oncology for years, but not in a vaccine. So that, I guess I'm confused. And then I have another part of my question too. I don't know if you want me to ask my second part as well.
Yeah, you can add your second part. That's fine.
Okay. Well, no, I mean, my husband works for the admin part of UPMC. He's not a provider, doesn't go into hospitals.
Oh.
And you know how they have to get, he does IT work, and they have to get the flu shot every year, even though they're in the office. I mean, they're required to get the flu shot, but they were told they're not required to get the COVID. And I don't know if I'm putting words in anybody's mouth, but I'm just relaying the message that they did not want them, or they weren't requiring them to get the COVID, like the flu shot, because again, they don't know the long-term effects.
That might not be. UPMC or any big organization has to first give the shot to patient-facing personnel. And I think the reason why your husband may not qualify is that he's at a facility that provides medical care, but he's not necessarily in the front lines.
Right. And he's not even in a facility to provide care.
So
he's downtown.
But correct. They're also not mandating it, by the way. None of us, and I don't think anybody can. That becomes something that I'm not comfortable. I don't know enough about. I think COVID is all an option for everybody. It's not going to be mandated. And now, if at least right now, I forgot your first part of your question.
Oh, just the fact that one of my doctors told me that the vaccine's been well proven, it's just tweaked for COVID. But then you had said that you've been using that technology for years in oncology, but now it's new in the vaccine. So I guess
we're both
maybe
right.
Okay.
I think we're both right. I mean, the COVID vaccines did not get FDA approval if they didn't do studies to prove that it helps for what it's supposed to help with. And so,
right.
Yes, your doctor is right. I'm also right in that we've used this messenger RNA technology for a while, just not in the infectious disease domain, if I make sense.
Oh, okay. So you've used that technology in oncology, but not to treat like infectious disease.
Yeah.
Okay. All right. No, I appreciate it. Thank you. And yeah, good information. Appreciate it.
You're welcome. There was somebody else with the hand up. Celine, is it you?
Yeah, I do have a question. After my second COVID vaccine, how long is it that the antibodies will be like as good as they're going to get from having that second vaccine? And I want to thank you also for doing this program for us. I appreciate it.
You're asking how good, are you trying to ask if you really need a second shot? Is that your question?
No, like after I get my second one, I've heard 2 weeks after you get your full antibodies, 4 weeks after, like I've heard all these different case scenarios of how long does it take after your second vaccine that you should have what immunity, well, not immunity, but what protection you're going to get from the vaccine.
Okay, so I would not do it earlier than 2 weeks. I would do it if you do it, but I'm not an infectious disease doctor, disclaimer again. Maybe in the second month, so somewhere between week 4 and week 8, when you should have your peak. The thing to know though, as far as I know, when it's now a few months later, so it may have changed. With most antibody titers, it comes on a continuous scale, and below or above which we have validated what means immunity. For COVID, we don't know that yet. We don't know yet how much antibodies measured at which time is reflecting someone having immunity. What I'm trying to say is, the last time I learned, oops, did we lose Celine? no. The last time I learned is that you just hear yes or no. You have antibodies or you don't, but not how much. They're not ready to release that information, at least not as of late last year. But I don't know if things have changed. I haven't ordered for anybody yet. Does that help?
Thank you.
You're welcome.
Thank you. Appreciate it.
I had a question, Dr. Van London. I had heard on the news that they got it mixed up between the first and the second vaccine, or I'm not quite sure what happened, but it made me think, is when you get these two vaccines, are they the exact same vaccine, or are they different?
No, same thing.
Two different, okay, two same.
And you get a little card with you. By the way, let me tell you that too. You get a little card that you have to bring your second time, because they're going to put a sticker on, 2 stickers with the lot number, and then you have to fill it out with your name, your date of birth. And a lot of my colleague physicians, when they just started getting their shots, they went on social media with the card, which has their private information on it. Just I know when you're getting excited to get the shot, maybe not. I don't know if you're excited about it, but just when you put it on social media, cover your stuff up. You know what I mean? Please. There's a lot of people out there who make it their job to try to be you. Yeah, I know. Then right now, Renee is texting something. At the time of vaccination, what do you need to take as proof of your comorbidities? Right now, believe it or not, as far as I can tell, it's just they believe you without any proof. There's no way they're going to check your record. There's no way they can handle that. They're just believing that people go by the honor system. Yes, the cancer group in 1A, is that just for those in active treatment or anybody who's ever had cancer before? Nobody's going to check that. So if you apply it in general terms, just say yes. Whether you had it yesterday, last year, 50 years ago, they're not quantifying or qualifying that. Just so I think all of you here would qualify. Maybe at some point they will tweak that, but as far as I can tell, they're not asking. You don't have to explain. You all had cancer. They're not asking when. Right now, the vaccine is being, see, they didn't ask me a thing. No, they're it's very difficult to do that, HIPAA wise and everything. Right now, the vaccination is being distributed with emergency approval. What will be necessary for the vaccine? More studies. And so many of you, I don't know if all of you do that, but through UPMC, I know that they're asking post-marketing questions. Every day after the shot, they're asking you, how are you doing? How are you doing? How are you doing? And that post-marketing data on a large scale for anybody who gets the shot, and I'm not sure they're asking that to everybody or only a selected population, will allow them to get more robust data that's longer term to get the full FDA approval. I don't know all the criteria, but that's what they will need to do. A much larger scale, almost a natural experiment. Martin says same with me. So Mary and Martin both are saying nobody cares what your history is. They trust you on your word. If you're in a group based on your age, they may ask you to double check your age based on a driver's license, but no. They're not weighing people either. Good. Otherwise, I would say eat 3 meals before you go. Don't do that though, but yeah. No.
Does anybody else have any more questions?
Did we miss anybody here? Oh, Mary has another question, I think, right?
Okay, I unmuted. And I've had several friends who are older who have got the first one, they're waiting for the second. And as Jen said, you hear stories on the news that, oh, the second batch, they can't get the second dose because they were delayed or whatever. And do you have to get the 2 doses within a certain amount of time from each other? Is there a problem with?
I would not do it earlier than I would not do it earlier than is recommended. In terms of spacing it out more, in Europe, they're actually looking at that. In Europe, it's easier for them to do studies. They're less restricted by, regulations. And so what they're looking at is whether more spacing might be more beneficial, getting a boost a few months later as opposed to a few weeks later. We don't have the data on that just yet. And the same question for those who've had COVID, do they really need 2 shots or is 1 enough? For multiple reasons. You don't want to put your system in overdrive if we don't need to. And at the same time, it frees up shots for other people. We don't know the results of those data yet. Hopefully Europe will beat us to the punch and tell us if maybe spacing it out may be more beneficial, but right now we don't know the data yet. And so the only thing we can do is follow whatever we do know, which is stick with the regimen.
Right. But if somebody can't get that second vaccine when they're supposed to, because things are being delayed or whatever, canceled, like they've been saying, we don't know what will happen. They just need to get it as soon as they can.
Correct.
Okay. All right. Thank you.
You're welcome, Mary. I guess maybe one more question. DiCarlo, last name, is saying, is there any time frame when they will know more about the effects of the vaccine in cancer patients? No. No, it's going to be months. It's going to be months. I would be. There's some data, however, let me rephrase that. There's some data that's. You're welcome, Renee. Little data that are institution based, where they've tried to look at the safety and the benefit of this in cancer patients, and for the most part, it's no differences. But I would say stay tuned. I don't necessarily. These studies are all, relatively speaking, small.
And I ask that because most medical professionals that I've talked to, or doctors, they say that they're encouraging all cancer patients to get the vaccine, but they don't have. I mean, of course, they haven't done a study, so they don't have any more information. So it's kind of like back on us as the patient, our own risk, taking it at our own risk. Because if there's no long-term effect, if there's no long-term information, but they know right now that if we get the virus, that we can die, but we could also die if there's no information to tell us about the long-term effect of it if we get the vaccine. So it's kind of like putting it back on us to make that, 6 in a dozen here. It's just like kind of, you don't really know.
Correct. The official clean answer would be yes, we don't know. But my gut tells me that the benefits are outweighing the risk.
Right now.
Until we have more information, yes.
And this is Sherlyn. I'm sorry, my husband is DiCarlo. I'm Sherlyn. And I just want to thank you also for taking the time out.
You're welcome. Jen, do you have one more question, right?
I don't know if you want to share it, but I know hopefully nobody will be in this boat, but if you are a cancer patient, either undergoing treatment or outside of treatment,
feel
like you are getting the virus or potentially, obviously you're going to contact your doctors, but do you have any thoughts or guidance for that?
Common sense. You know that something is happening with you. You feel, just be aware of it. Like, I didn't know. I guess I wasn't aware. Let me say it that way. So first, how did it present with me? I had diarrhea first, but I was on antibiotics. So I thought, okay, it's from that. Then my nose started running, and I thought, well, it was at that point, flowers are growing outside. I thought it's allergies. And more symptoms started popping up, and I'm like, wait a minute, maybe something is going on here. It took me a while. Now, I was isolating myself anyway, so I didn't make anybody sick in the meantime, but just be in high alert. If some symptoms develop, just think maybe this could be COVID. Not so much for your purposes, but to protect others. To maybe don't decide not to socialize with somebody, or don't go to the grocery store until you know how this is going to evolve one way or the other. Lots of things have changed and over the last few months. I think the isolation guidelines have decreased from 14 to 10 days before you can go back in the normal community. If you were positive, two things to note, which are handy to have at home. One is the thermometer, and the other one is a pulse ox meter thingy. Very silly two things, and make sure they work. Even if your thing worked a year ago, doesn't mean it works now. If you don't really feel well, it's not really pleasant to putz around with batteries and stuff. But those will help you understand what's going on. That may help you differentiate, am I having some allergic reaction, or is it something else going on? So use common sense. If you suspect your symptoms could be COVID, I would call and ask your doctor, because things are changing almost every day. And so just touch base with your primary care doctor, and they will tell you whether or not you need to be tested. We're testing a little less proactively at this point. So don't be surprised if they tell you to just keep an eye on yourself and call back if things worsen. Because we're not testing everybody proactively, but that again can change. So I would stay in touch with your primary care doctor, say, these are my symptoms, and then see what they advise you to do. So you're up to date with the latest and the greatest. Remember, not everybody gets sick from this, and not everybody gets really sick from this. So don't, I know a lot of my patients get scared when they're potentially have been in touch with COVID and it's starting to come close. It's understandably so. I'm not trying to tell you to now, sing around in the park, but at the same time to just breathe, just go take it an hour at a time, a day at a time. And another reason why it may be helpful, Jan, that might be good to say, to stay in touch with your doctors, is because we have some experimental treatments now available, and I won't mention names because each change as experiments finish or not, where we help outpatients to prevent them from needing to be hospitalized. So if you're at risk for bad complications from COVID and you present with COVID symptoms, your PCP might alert you to, hey, maybe we should give you an infusion of this in the outpatient infusion center to help you, reduce your risk that you ever need to be an inpatient at a hospital. Does that make sense? And so there's two reasons to inform your PCP, just to know that you're doing the best you can do to protect others, but also the best you can do to prevent yourself from getting really sick. Did I make sense there?
And the one thing, I think I was either reading one of your blog posts or listening in on a Facebook Live that you did, and you had suggested that everybody have like a COVID kit at home, or a COVID plan, which I really thought was brilliant. And if from memory, you had asked that everyone have a thermometer at home, and also have a pulse ox, which is that little device which you could get at Rite Aid or any grocery store or drugstore for probably $20-30, which measures, your oxygen level in your blood. I think you also just said like have some alternate way to get food, or but I just thought those were really fantastic ideas. So I don't know if you can remember all of them or.
Okay, one thing that's my pet peeve, okay, and I don't have any stock in this, but I probably should. Get yourself a phone charging cable that's at least 8 feet long. Because if you do go to the emergency room or to the hospital, their plugs are behind your bed. And everybody is going to call you and text you. That's your way to be in touch with your family members, and then you can charge it while you're using it in your bed. That for me, I have 3 here because I will never run out of a cable that doesn't work. That is silly, but very, very helpful. Because when you do have COVID and you go to the ER or to the hospital, they usually don't let anybody else in. And so then you still feel like you have somebody with you if you can charge your phone nonstop. Just think what you think you need to have ready. Just a little baggie ready to go. I always have it in the corner of my bedroom here, what I call a hospital bag, that my husband knows where it is because he's not one of the most practical people. I don't know what the word is to use, but
Not
so
a planner.
yeah, I put everything in there that I think I may need from, you know, I like my chopstick and things like that he will never know where to find. I threw it in there, and all he has to do is bring that back to me. And then when I, you know, need something, that's all he has to do. Just help yourself, that you don't have to stress and talk, and use your oxygen to explain people things that you can make ready in advance. Does that make sense to all of you?
Mhm.
Carl
Yes.
has maybe one more question, or you think we're done, Jen?
No, we can answer that one. My last question, please, could flu patients be misdiagnosed as having COVID, since COVID is the main focus right now?
Could, yes, and that's another reason, I guess, to call your doctor. When they do test you, they usually test you for everything at once. So that we would know what is what. It becomes a little tricky on us because there is antiviral regimens orally for flu that don't work for COVID. And so for primary care doctors, it's pretty hard this season to be able to figure out what does somebody have and what do we need to prevent things from getting worse. So yes, I don't think that there's a clear answer as to how to differentiate the two, other than that COVID can make people, it has a second phase to it, a second week to it, when your immune system goes into overdrive in reaction to what the exposure in the first week. And so that puts things aside. With the flu, after a week, usually you're better, or at least on the mend. With COVID, there's a 2-peak situation. That is, I think, one of the bigger things that differentiates. Other than that, it can have the same presentation. I mean, you can have loss of smell with both.
Yeah, thank you for that.
It's hard. I'm not sure how to, honestly.
No, that answered my question, because I guess that going into the second week, you'll see a little more clarity if it's COVID or not. Okay, thank you.
Yeah, but I would ask your primary care doctor, I would call them, because on each individual situation, when you develop symptoms, call them. Because based on everybody's individual situation, you may need to be a little bit more on top of it. In others, they may want to monitor you just a little bit more. And I don't know who here is who. So I still tell all my patients, call your doctor as soon as you have some symptoms, even if you don't know what it is, just let them help you figure it out one way or the other, if they feel they need to.
Okay, thank you so much.
You don't ever have to be concerned you cry wolf. And if they make you feel that way, oh, well.
Right, change doctors.
Yeah.
Thank you.
You're welcome.
Well, I think we're out of questions, and this has been fantastic. I just want to thank you, Dr. Van Lunden. It is amazing as usual. You are just a wealth of knowledge, and we appreciate you taking the time to share with us. I know you probably worked a full day and you're probably tired, but and there's so many questions surrounding this that still nobody knows. So we're trying to work our way through this the best way we can. So there's a lot of thank yous in the chat, and I will, all the notes that Dr. Van Lunden gave us, I will post on Facebook. Okay. And if you are not on Facebook, you can email me at cancercaringpgh@gmail.com, and I can email you out those links. And if you are not on our weekly email list, you can send an email to me at the same, and it's cancercaringpgh@gmail.com to get on the weekly email list, because we have a lot of fantastic programs. We have 5 occupational therapy students that from the University of Pittsburgh that are beginning a series which starts, I guess it's next Wednesday. Wow. And that's going to be living life to the fullest. And they're teaching us how to overcome barriers and remove, get us back to normal life, which is really their goal, which is, I'm pretty excited about it. That's I believe a 6-week series. We also have a new GI tract support group starting we're going to have a large event in March, and then the group will start in April. We also have a survivorship group that'll start in March that I can give you some more information about. So we've a lot of good stuff going on. It's gonna making my head spin. But and then we also tonight, if you're bored, or if you if you have any memory problems at all, like myself, you are welcome to join us at Cognitive Toolbox, which is run by the UPMC Centers for Rehab, and it's excellent. I do record those too, so if you have any interest in watching the previous ones, you're welcome to. And you can email me. And Dr. Van Lunden just sent me a study for chemobrain research for breast cancer patients that have either stage 1, 2, or 3 and completed chemotherapy within the last 5 years. So I'll be posting.
Okay. Well, can I send you another flyer?
Sure.
There's another researcher that is looking, there's some man in this group here, believe it or not, but that's very good because usually men, I know, Rach, usually men don't, I don't want to generalize it, but they don't usually ask for help the way women do. And so there is a researcher at the School of Nursing who wants to hear from male cancer survivors and how they feel that they can or should be helped so that we can make appropriate resources for them. And so if it's okay with you, maybe Jen, I hope to remember tomorrow. Can I send you something that maybe you can send to, because there's a lot of men in your group.
Yeah, we welcome men, and we have some awesome men.
I know.
And we'd like to find ways to serve them better. You know, whatever. If you have any ideas, I'd love to hear it.
Thank you.
You know, we welcome everybody. We just I think it's awesome just to get all the different sides and see how people, you know, whatever support different people need. So we'd love to be a part of that research study because I think it would help us as well.
Thank you. Thank you, everybody. I wish you good evening. Okay. Bye.
All right. Thank you so much.
Thank you so much.
Dr. Van
Thank you.
Lunden.
You're welcome.